A recent AM Best report cites high U.S. unemployment and an economic recession as factors that will drive Medicaid enrollment higher. But additional pressures on state funding may strain programs and payments over the next year. Here to discuss how this may ultimately squeeze the margins for Medicaid managed care providers are Associate Director Jason Hopper and Senior Financial Analyst Wayne Kaminski. Wayne, we're going to start with you. Can you take us through the role that states have played in the Medicaid expansion since 2014?
If we go back in time to 2010 and the passing of the Patient Protection and Affordable Care Act, the ACA or Obamacare, the new law outlined a plan for states to expand their Medicaid programs. The ACA was later challenged by legislators and went all the way up to the Supreme Court. The expansion for states moved forward following the U.S. Supreme Court's decision to uphold the ACA in June 2012. However, the court revised the original Affordable Care Act so that states would have the choice to opt into Medicaid expansion programs or not. The ACA was effective January 1st, 2014. So initially, there were 24 states approved by their governing bodies to participate in the expansion. The ACA provision for Medicaid expansion called for the federal government to finance 100% of the costs of the newly eligible beneficiaries from 2014 through 2016. And then the federal contribution would be phased down to 90% of the cost by 2020, this year. After that, states will continue to pay the traditional Medicaid match rates for increased participation among those currently eligible. So since that initial period, the 24 initial states participating has grown to 38 states and the District of Columbia. 2 states included in that 38 count, Oklahoma and Missouri, are the most recent states to adopt expansion. And there are 12 states remaining that have not approved the expansion.
Jason, the report notes that Medicaid enrollment declined in 2019, yet premiums rose by 11.8% following a trend of the last few years. What factors are behind that sort of development?
So the expansion of Medicaid under the ACA initially led to an enrollment boom, kind of as Wayne alluded to, with the larger number of states expanding pretty much right out of the gate, right? Now, it's important to remember that Medicaid enrollment is countercyclical to the economy. Enrollment goes down during periods of economic strength, and vice versa goes up during weak economic periods. Now, unemployment before the pandemic, unemployment has been relatively low. So the favorable economy and the fact that several states were granted waivers for Medicaid eligibility, such as work requirements, did put some downward pressure on enrollment. So now on the flip side, as you noted, John, premiums have been going up. This is due to a combination of factors, including rate increases, state-specific program expansion, which we note that premium is higher for newer expansion to kind of cover the pent-up demand that insurers were expecting to see. And more states are turning to manage Medicaid. It offers more budget predictability, constrained spending, and offers a better overall value. In light of this, insurers have added dual eligibles and other long-term services and support contracts. So kind of with those factors, 70% of Medicaid enrollees are now enrolled in managed Medicaid plans. And overall enrollment is up 2% through second quarter 2020, pretty much gaining back all the members that they lost during 2019.
So what can you tell us about earnings among the managed Medicaid riders?
Earnings has been consistently profitable for the industry, although we do note that margins have been tight. Margins have been less than 1% for each of the last 4 years. Almost 2/3 of companies saw a decline in underwriting profitability in 2019. And a similar percent reported a loss, which has been the highest in a decade. Looking forward, kind of in light of the pandemic, we do expect budget shortfalls related to COVID-19 from the states, which could lead to rate cuts, which would further pressure future earnings, as well as state payments potentially becoming delayed, which could ultimately affect revenue streams for insurers.
What impact has COVID-19 had on the Medicaid market?
So prior to COVID-19, we were seeing Medicaid enrollment trend declining that was for various reasons. There were states seeing negative effects on enrollment following the state passage of a work requirement waiver. And also the decline was partially due to the steady economic growth and employment at high levels. The stay-at-home or shelter-in-place orders due to COVID-19 had a direct impact on employment. Whether it was a person furloughed, laid off, or now permanently out of work, there were people that no longer had health coverage through their employer's health plan. The prolonged period of unemployment is having a direct effect on state Medicaid program demands. And that heavy demand doesn't bode well for the states where their budgets not only have been strained by the need to address the healthcare crisis, but have been strained by the adding eligible people to their program rolls. And this adds significant strain for states to stay within their budget limits. What we're more concerned with is the unemployment rate staying persistently higher and COVID-19 infection rates continuing to rise, particularly in those states that haven't expanded their Medicaid programs. Those states will have to find ways to generate savings in other areas of their budgets if they're to maintain funding of their Medicaid programs. We suspect that they may have to make direct cuts to these programs.
And how are they now bridging that gap of extra cost?
Sure, good question. The Families First Coronavirus Response Act, passed in March, provides states with an additional 6.2% increase in the federal Medicaid assistance percentage, FMAP, which is added to the federal portion of Medicaid funding during the period of declared public health emergency. That declaration was made at the end of January. We just learned that Health and Human Services has extended the Public Health Emergency Declaration, which is tied to the Families First Act. This extension is for another 90 days from October 23rd, which means the 6.2% increase is extended and will help alleviate any additional budget strain into 2021. But again, this is a temporary extension and not permanent. If the states aren't funded adequately, their programs are in jeopardy of program cuts, resulting in states faced with reducing their enrollment or benefits. This, in turn, could lead to a reduction of health plan participation.
Was Associate Director Jason Hopper and Senior Financial Analyst Wayne Kaminski. You can find the full report online at ambest.com. For AM Best TV, I'm John Weber.